Right.
Well, no, my people knew.
Oh.
So I was supposed to be in Baton Rouge. There's a nitrous oxide. So this is showing my age. So I live uptown, and I live near the two-way road.
So hey guys.
So I'm running and working out, and I see all these little silver canisters. I'm like, man, they're doing soapbox. They don't even know heels. Like, what is this? Well, it's the whippets. And they're buying the industrial size because they use nitrous oxide to make whipped cream. So it's an abuse thing. It's an abuse thing. So there's a bill, Representative Stagney has a bill to curtail it because they're ordering offline, ordering it by the canister from food supply stores. And B12's going, so the nerves get messed up. Just all kinds of stuff happening. So that was at 10 o'clock today, and I was supposed to be testifying at the legislative committee in Baton Rouge. And I was like, Ms. Lena would kill me. So I had to write a letter instead, so I'm here.
Yeah, they have nitrous oxide parties.
What is that?
Yeah, it's just, that's the new thing. They have parties.
But when I've gotten
On the
nitrous
college
oxide
campuses, that's like the thing now.
for my wisdom teeth, I barely remember it. So this.
That's what they do.
I didn't know that
That's
was
the
a thing.
thing. Yep.
So let me not be rude. This is, I have a mentee. This is my second in my life. Kwame Tara. Kwame owns, he's doing an amazing thing in the tech space. If you can imagine like remote patient monitoring, but collectively for the community. Am I close? Man, you can speak for yourself. My bad.
Councilmember Griggs. So we have 5 members. We have 4.
Thank you, Madam Clerk. Pastor Bouchan will be leading our prayer. For those who can stand, please do so.
This is a presentation. Dr. Jennifer Avedno, Director of the New Orleans Department of Health. Dr. John Vaughn, Public Health Clinic Director, New Orleans Health Department. Dr. Dwight McKenna, Orleans Parish Coroner. Dr. Jeremy Dumas, Chief Medical Officer, Inclusive Care. Dr. Eric Griggs, Access Health Louisiana. Dr. Valentine Infonson, I'm sorry if I messed up your name, Chair of LSU Surgery Department, and representatives from the Louisiana Cancer Center, Tulane Medical Center, Ochsner Health, Turo LCMC Health, and Prostate and Colon Cancer Survivors. The honorees, Frank Robinson, Councilmember at Large, J.P. Morrell, Augusta Melville, Councilmember at Large, Helena Marie.
And to help people move forward in great health. I want to tell you that today my remarks are very simple. We lose too many people to prostate cancer and the colon cancer, colorectal related illness and disease. And the more that we talk about it, the more I think people will be willing to do the screening that is necessary, the testing that is necessary. And you, by being here today, may help someone, but you certainly already, because I've already gotten phone calls from people who just appreciate the fact that professionals such as yourself are coming to talk about a subject that we don't talk about enough. We need to talk about more, and if we talked about more, it could save lives. Before we move forward with your presentations, which will start with Dr. McKenna, I'd like to ask Councilman Freddie King if he will introduce a special guest who has a special gift for all of us today.
Thank you, Councilmember Griggs. It is my great pleasure to introduce Abigail Marie King. She is going to start the day off with a musical note. So I'm going to do it the way we write that home. Coming from Algiers, Louisiana, I present to you Abigail Marie King.
Dr. McKenna, and for a little while, and I will say that I appreciate the members of the council for allowing the 3 orders of business today to be dedicated to such an important subject matter. Certainly health, colorectal and prostate cancer, we know the devastating effect that it has on our communities. And even before we move forward, I want to thank Ms. Lena Stewart and also my legislative director, Attorney Monique Green, not related. Also, and I always make that clear. At the end of the day, their work and the work of the staff members in Councilman Thomas's office and in my office and
Prostate cancer, colorectal cancer, picture of cancer. You can detect those early and you can make a difference. There's a reason why we have a colonoscopy and it looks good, they may tell you come back in 10 years or 5 years. It's going to take that long for something to come up that's going to be of significance. Problem comes when you don't get that screening. You're 45, you're going to think about it later. 50, you're going to think about it later. Maybe you get busy at 52 or 53. And you start having problems at 54, and we see this a lot, and now you're afraid. Because I've been having some issues. An amazing amount of people are afraid to go to the doctor because they don't want to hear what's going on. The ostrich theory of medicine and healthcare would never work. You can't turn your head in the sand and pretend that it doesn't exist. We run into a little bit more difficulty. Our clinics are primarily on the West Bank and primarily in the African American community. If you're going to look at prostate cancer, even colorectal cancer, and I'm not going to have all the statistics, but we have a ton of smart people. Your picture, both cancers are very preventable. They're easily detectable. The screenings are painless despite what anybody thinks. And two of the few cancers that we can actually make a big difference if we catch them early. So there's no reason that our mortality rates, our cancer rates should be that high with those two particular diseases.
Good morning. So let me get the doctor stuff out of the way. I just had an epiphany moment. The stats are 1 in 8 men in the United States will be 1 in 7. Will be diagnosed with prostate cancer. 0.7 for black men. And then for colorectal cancer, it's 1 in 23 for men and 1 in 25 for women. I had a moment, and I had to stop myself from getting emotional because I just realized when back sitting here, it was actually 10 years ago to the month. I came in here with my hula hoops, talked about I get checked, get fit, get moving, and I went on an underwear exam crusade across the city. Barbershops, at the churches, on the radio, everywhere I could. And the reason it was an underwear exam is because most men, when they shook my hands, they were like, "Doctor, your hand's too big to be my doctor." I'm not going to get that exam because I don't want to be fame. And they associated the colorectal cancer, the colonoscopy with fingers. So I did this thing, and we were pretty successful. But then, in the midst of it, one of my best friends, Danny Williams, who I'd have on the radio with me, we were jogging, trying to raise money for the American Heart Association, and he kept having pain in the lower left quadrant of his stomach. And I thought he was just, kind of not really wanting to run. We were at mile 9 or 10. Kept pestering him to go to the doctor, and he was 41 at the time, and it turned out to be colorectal cancer. And it was the size of a golf ball. Now he was only 41, which means he didn't fall into those lines and those parameters, the stats that I just said. But it fell on my doorstep and in my heart. So it was 10 years ago that I started that campaign, and I had him on the radio. I did everything I possibly could, but sadly it was too late. No one in his family talked about cancer. He didn't know, and we still don't know if he has a family history of colorectal cancer or any cancers. 1 out of every 5 deaths in the United States is due to cancer. So before we went to school to become doctor this, doctor that, well, I was just Eric with close friends and family. And right now, in my immediate circle, I have 5 men that are either immediately post-survival for prostate cancer, and 1 actively with it, he might have just turned 40. Another one in his late 60s that just had it. And then 2 doctors, 2 of my colleagues, who when people want me to come and be on panels to speak about prostate cancer, I usually, if they're in town, I try to defer to them because no one is more of an expert on your body than the amazing people in this room that have survived. So it's one thing to talk about something objective. And we're talking about prostate cancer and colorectal cancer, and it's emotional for me because the campaign continues. Now, I got that. to help spread the word. But if anyone can avoid the pain of losing a loved one to something that is truly curable by prevention, and it's simply a conversation with any of these colleagues or anyone, any of their doctors, then I'd love to do it, and I'm proud of you. I'll stop there. I don't want to start crying to my dad in a minute.
Thank you. I appreciate that. I appreciate that. It's not one size fits all. Right? So coming from Arizona, where we had to private the border areas, we had to lobby the state government to provide funds for screening and education. Health education is key.
At the panel here that at the time in the emergency department that you were seeing me, it's way too late. There's a common echo and theme that is frequently, being brought up here, and that's the word of screening. Screening is so important and it's pivotal that you do so for what makes sense for you, right? As you've heard here, there are many different methods of screening. There are blood tests, there are physical exams, and you can work with your provider to figure out what is the best method for you to get to the best optimal health. The public health provider in me, as an employee of the health department, is saddened when I have to unfortunately go to a patient and tell them that the imaging that I got for them for their belly pain or for their weight loss or for their frequent, urination or their inability to urinate, blood in your urine, weight loss, at that point, a lot of times it's too late. And I hate to be graphic, but these are the things that our patients at that point are commonly presenting with. When, with their primary care provider, they could have done testing, had the appropriate screening, and maybe would not have been to that point. As others have also echoed, the survivability when you do the early screening and detection, if it's combined and the cancer is combined, at that point, your survivability for at least prostate cancer is up to 98%. So we're seeing that when you can intervene early, you're saving lives, you're able to be there for your loved ones. So if you don't get anything else from today, I would like to just echo screening. It's important. With colon cancer, we're seeing that less. I think before we're thinking, I'm too young, it's not time for me. Regardless of your family history, a lot of times you may not have any symptoms. So that's why it's really important, to think about these things, to talk about these things with your loved ones, to encourage others to do the same, even if that's bringing your family member to the doctor's appointment and advocating whatever you have to do. Just advocating love on your loved ones and bring them in so that we can all be healthy.
I'm Dr. Anthony Jase. I'm Director of Population Health with Inclusive Care. And originally I was supposed to be here for support, but my medical director, Dr. Dumas, dragged me up here. And I can piggyback on everything that all the panelists said this morning. You can spit out a bunch of statistics, we can use a lot of big words, but I like to always try to relate to my patients in layman's terms. And the bottom line is, prostate cancer and colorectal cancer are two of the few cancers that we can completely cure or get rid of if we catch it early. Now, each of these cancers are associated with certain signs and symptoms. With the colorectal cancer, you could have blood in the stool, you could have abdominal pain, you could have change in your bowel habits, all of that. You could have weight loss, same as with prostate cancer in men. It can affect how you urinate. As you get older, you develop these problems. But I like to impress upon the patients is, don't wait until you get problems. Because out of all of those symptoms that I just mentioned, the main one that I always harp on is no symptoms at all. I'm gonna say that again. The biggest symptom is no symptom at all. So how do we combat that? We screen. We go to the doctor, we get checked regularly. Because once again, these are two of the cancers that if addressed early enough, there's a greater than 90% chance that you will die from something else other than those two cancers. So if we could just impress that upon our patient population, and then get past the negative stigma of getting tested, then hopefully we can make up some ground as far as increasing our screenings and addressing these problems in our community.
Silent people who did it, and it took it. So I want to echo what's been said already. Early detection, early screening, this is something that's truly preventable and curable. Thank you.
Medical angels, really. People I work with in the community. Dr. Griggs, over 10 years ago, WDOK started a show, Get Check, Get Moving, focused on African American men and women in their overall wellness. 30 years ago, Dr. McKenna, he did a study on black women and boys 30 years ago, their overall wellness. Just recently, the Brookings Institute came out a report about how black men and boys are in jeopardy in the face of every social institution, from their wellness to their economic stability. CNBC just came out with a report not too well that said that how black men and boys are being left out of the economy. Dr. Dumas, your family has been committed to medical wellness for years. It's 1.2 and 1.7%. When we talk about these two cancers, especially as it relates to our mortality rate. I say that because overall wellness and general health is really not about race. But when you talk about mortality rates and disparity, it absolutely is about race. I was fortunate enough, and I am fortunate enough, to have a doctor during my general checkup and wellness who didn't wait ask for my permission to schedule it. Dr. McKenna scheduled it and told me what day I was going to go. And I say that because for the men and women at the table, you all have worked hard to make sure that we can live in spite of. Dr. Vaughn, your comment that says what it tells you, and in the research and conversations that Dr. Griggs and I have had, there's another indicator that led to Dr. McKenna's report on black men and boys. That led to the work that LCMC does for overall wellness for black folk. That led to the efforts of Dr. Dumas and Dr. Val and others. And it says exposure to our environment. Those medical, those nutritional things, right? The disparity that happens after the fact is one thing. But to understand what Charles Blow says is what it means to be African American and step out of the door. The stresses of the environment that have an impact on not just our overall wellness, but our ability and inability to fight diseases that are not just manifested for us. So Dr. Vaughn, when you say what does it tell you, it says that society, Dr. Griggs and Dr. McKenna, Dr. Dumas, Dr. Jase, young lady, has to take a greater look at our exposure to stuff, and to stresses, and to stress, and to disparities that other communities are not exposed to.